Why are specific MRI sequences crucial for brain tumor detection? Imagine trying to find a tiny needle in a large haystack. That's similar to detecting brain tumors inside the complex structure of the brain. Magnetic resonance imaging, or MRI, is a powerful tool that helps doctors see inside the brain without surgery. But not all MRI scans are the same. Different sequences or settings are used to highlight various features of brain tissue and tumors. These sequences work like different lenses, revealing unique details that are essential for accurate diagnosis. One of the most common sequences is T1 weighted imaging. Before and after giving a contrast dye, T1 scans provide detailed pictures of the brain's anatomy. When contrast is used, it highlights areas where the blood-brain barrier is broken down, which often happens in tumors. This helps doctors see the exact boundaries of the tumor and whether it has invaded nearby tissues. T1 sequences also help identify substances like fat or blood, which appear bright and can give clues about the tumor's nature. T2 weighted imaging is especially sensitive to water. Since tumors often cause swelling or edema, T2 scans are great at showing these changes. They help visualize the full extent of the tumor and the surrounding white matter affected by the growth. This is important for planning treatment and understanding how aggressive the tumor might be. Another valuable sequence is fluid attenuated inversion recovery, or FLAIR. This sequence suppresses signals from cerebrospinal fluid, making it easier to detect lesions near fluid-filled spaces like the ventricles. FLAIR is particularly good at revealing tumor-related edema and infiltration that might be hidden on other scans, giving a clearer picture of the tumor's reach. Diffusion-weighted imaging, or DWI, looks at how water molecules move within tissue. Tumors with high cellularity, meaning lots of cells packed tightly together, restrict water movement. DWI can identify these areas, helping distinguish aggressive tumors from other conditions like abscesses or strokes. It's a quick way to gather clues about tumor type and activity. Susceptibility-weighted imaging, or SW, detects tiny blood products and microhemorrhages inside tumors. This information can be important for understanding tumor grade and planning surgery, especially if bleeding risks are involved. Advanced techniques like diffusion tensor imaging, or T, map the pathways of white matter fibers in the brain. This helps assess how a tumor affects critical brain connections. T is especially useful for planning surgery to avoid damaging important areas and preserving brain function. Using multiple MRI sequences together gives a comprehensive profile of the tumor. For example, combining T1, T2, and FLAIR scans helps differentiate the tumor core from surrounding edema and necrosis. Contrast-enhanced T1 scans highlight areas with increased blood flow and blood-brain barrier disruption, often seen in malignant tumors. This detailed imaging approach is especially important in children, where tumors can look different, and precise localization is vital for safe treatment. It also guides neurosurgeons during operations, helping them remove as much tumor as possible while sparing healthy tissue. In summary, specific MRI sequences are crucial because they reveal different aspects of brain tissue and tumors. They improve detection accuracy, help determine tumor type and grade, and guide treatment decisions. They also support surgical planning and monitor how well treatments are working. This multi-layered approach ensures that doctors have the best possible information to care for patients with brain tumors. Always remember, if you or someone you know is facing a brain tumor diagnosis, consult with healthcare professionals who can interpret these scans and recommend the best course of action based on individual circumstances.